In news for your health, more adults are struggling with symptoms from attention deficit hyperactivity disorder, also known as ADHD. It's typically thought of as a childhood condition, but since the pandemic, more adults have been seeking help. News 4's An Yang explains what to look for and how to get help.
Adult ADHD diagnoses have surged in recent years. The CDC now estimates 15.5 million American adults have ADHD. That is up significantly, and more than half receive their diagnosis as adults rather than as children. Some experts are saying this is a long overdue recognition of a condition missed in millions of people, especially women. Others, though, are sounding the alarm. Psychiatrist Dr. Joshua Weiner joins us now to cut through the noise on this controversial topic. So much to get to. Thanks for joining us. So ADHD used to be seen as primarily a childhood condition. What's changed, and why are we seeing so many adults being diagnosed now?
Well, so ADHD in adulthood is not a condition that you sort of catch as an adult. It's not like the cold or the flu. 50% of kids who are diagnosed with ADHD will go on to be adults with ADHD. So generally speaking, these are adults who just were not diagnosed in childhood. Had they seen somebody when they were younger, they would have gotten that diagnosis, likely. So that's the reason why we're seeing so many more of these people coming out, because ADHD has just become such a more recognized condition over the years. Interestingly enough, there's really been a skyrocket since the pandemic. So numbers of people being diagnosed with ADHD, both adults and kids, have gone up significantly since 2020. For adults, it's about 35% increase. And interestingly, in Canada, it's up about 300%. So this is not just a phenomena in the United States. What I think happened during that pandemic is people were stuck at home. Adults were trying to work. They were trying to manage their kids. They were trying to do all these things, and they were struggling to manage it all. That led to many of them going and trying to seek help and a diagnosis. And then, the reality is, I've talked about this before, when you go on these medications, a lot of people feel better, even if you don't have ADHD. You have more energy. You're more interested in doing boring tasks. You don't mind cleaning as much. It curbs your appetite a little bit. And yes, it helps with focus. So these are all factors that I think contributed to this rise in the number of people getting this diagnosis in adulthood.
So how do you distinguish then between someone who has ADHD versus someone who's just struggling with focus in an overstimulated world? Especially as adults, we're juggling so many things in our lives. It's easy to kind of get pulled in different directions.
Absolutely. This is what I hate about my field. Unfortunately, there's no way to diagnose anything with certainty. So that it's just an uncertain field, which I really hope will change at one point in time. We're just not there right now. And everything in psychiatry is like that, right? We all get sad sometimes. We all get anxious sometimes. Really what it boils down to is, do these symptoms of inattention and losing things and forgetfulness and disorganization, poor time management, etc., do these really impact your day-to-day functioning? If they're really causing problems in your day-to-day functioning, then we say, okay, maybe you have ADHD. If it's just happening sometimes, when you're in a crowded room or when you're trying to work and there's a lot going on, then we say, no, you're just being distracted. You got stuff going on. So, but unfortunately, it's just a wishy-washy field.
That's really interesting. So for someone then who suspects they might have ADHD, what is the right way to get evaluated?
So you want to talk with somebody who's got a lot of experience in treating this. So ideally, you want to see a child psychiatrist. Child psychiatrists often treat adults as well. We have tons of experience with this. So that's going to be your first step. The other thing would be getting a psychoeducational evaluation. So these are things that can even be done for adults. The problem with these, they're 8-hour-long tests done over a couple days. They're very expensive if they're not covered by insurance. But that's sort of the only way to get a more objective measure. There's some computerized tests that can be done to then see how you compare to sort of the standard population and whether on these more objective measures you're having difficulty with sustaining focus. But really, again, what it ultimately boils down to is just taking a good, thorough history by the doctor.
All right, important information. Dr. Joshua Weiner, thanks for joining us.
Thank you.